this time, Fabio, we make some revision of the case that we've done the procedure, the previous edition of this course. And you have some insuccess. Fortunately, just one patient. We lost 2 transnasal implants, and you bring back the same patient to give the solution to this patient. So no patient is left behind in our perspective, and we will follow up all the cases. That's an important thing that we should pay attention in our view of the world. Always look to the person behind the technique. And Fabio, in your point of view, what the future of the maintenance of these full arch cases? What the gaps that the market has right now, and what your vision for the long term about the healthy of these implants and prostheses?
Again, Fernando, I really think that we have some important gaps, and I also want to thank Patrick Dewey for doing that, because he's a close friend. I've talked to Patrick a couple of times, and for sure it's going to be a very strong collaboration. Probably we're going to have a group of surgeons going to Scottsdale to learn a little bit more there, and having other groups until you have the same protocol in the United States and in Brazil, and then globally, as Raj just said. And I'd like to say that I'm still part of the game, so I'm still in contact with Felipe, with Alessio, the entire SIN team. I'm not just the director of the R&D department. And to start this new challenge, that I would say that if in one time we are discussing probably the best implantology in the world, we're talking about 360 photogrammetry, we're talking about pterygo and 45 angled abutments. When you look to the literature, we don't have a golden standard protocol how to maintain the healthy of the treatments. Actually, it's a little bit scary when we look to the literature and you can find some data such as 45% of mucositis in patients with full arch treatment after 5 years. And we also have some problems such as periimplantitis. So I really think that one area that be very interesting is how to create a protocol to maintain the healthy of the implants, and most important than that, the healthy of the patients. Because if the patient lost and missed all the teeth, he had problems. It could have been systemic problems, it could have been some problems with periodontitis or some different things. So we started with the SIN team a couple of years ago, this new project that is new company that's called New Dental Care, when we have created some products and protocols to minimize the risk of the problems during the surgery, right after the surgery, and after the prosthetic rehabilitations.
Really nice. You can imagine that after a huge intraoral surgical procedure, most of the time people go home and take their toothpaste with whitening capacity and use this kind of products right away after procedure with a healing phase, with very harmful agents on this product. And I think that what Fabio has been doing during the past years, developing the products that are in our help to create the best condition to healing the incision, and keep the post-operative. I think it's a really necessity right now. I think that chlorhexidine avoid infection, but does not promote healing. That's a game changer. And for example, when it comes to enamel, if you compare the surface of the artificial teeth and enamel, there is no relationship. It's kind of different product that you need.